So we certainly will talk about diet. In fact, I got one question on diet before everyone got here, and it's really important and interesting, so I think I'll hit that right away. What's my opinion on butter versus margarine versus, is that the right question?
Yes, especially butter, you know,
Okay.
I've heard that it was better to use that than margarine, but I was just kind of wondering what the take
What
was.
the current thing is. Well, you know, when Eisenhower had his heart attack in 1955, he was out hunting in Colorado. We had no clue what caused a heart attack. And since the President of the United States had a heart attack, you know, the government figured out, we have to figure this out. In fact, in 1955, when he had his heart attack, the treatment was 6 weeks of bed rest. You probably all remember that. And the government told the American public that he was away on a 6-week hunting trip out west and didn't want to be bothered. Because back then they didn't want the Russians to know, you know, that the president had a heart attack. Well, then they started doing autopsies and they looked inside the arteries of people who had heart attacks. And what they found was fat. Fat was that's what was clogging up the arteries. And even to this day, if you look inside the artery of what caused a heart attack or a stroke, it's fat. So they said, aha, we need to tell people to eat less saturated fat. So you get into the 1960s, and that was the word from the American Heart Association. Cut down on saturated fat. In fact, I grew up in Green Bay. My parents drove to Marinette to buy margarine. You know, they thought that was healthy, and this is a dairy state, and they wouldn't allow margarine. So, if you ask me this question in the 1960s, the answer was, whatever you do, don't eat saturated fat. So it was thought that margarine was a healthy thing to eat, and butter was out. Well, if you ever put a stick of butter and a stick of margarine on your workbench, and you come back 3 months later, margarine is plastic. It will still be intact on the workbench, even if you put it there in the middle of summer. Margarine is made of what we call trans fats. Trans fats are man-made. They do not exist in nature. There's no natural form of trans fats. It's a man-made chemical, and it has a nice texture in that it keeps things nice and solid. So it's perfect for margarine. Trans fats made Pringles what they were, where you couldn't crumble a Pringle when they were full of trans fats. You know, I remember, you know, my dad even used to like crackers back then because they were crispy, and now these crackers just kind of crumble because they were all full of trans fats. Well, as it turns out, you can't get an unhealthier food than trans fats. Trans fats do everything wrong. They raise your total cholesterol, they raise your blood sugar, they raise your triglycerides, they raise your bad cholesterol, and they lower your good cholesterol. They do everything bad. And they promote the accumulation of fat in the arteries. So now we are doing what we can to ban trans fats. In fact, in the city in New York City, it's against the law for restaurants to serve trans fats. So we're kind of swinging back a little bit. And what we now know is that saturated fat in moderation is okay. And if you're going to eat saturated fat in moderation, the best way to eat it is a natural form of saturated fat, which is butter. Now you need to limit you have to choose where you're going to get your saturated fat. You know, you can't have, you know, bacon and eggs with toast with butter for breakfast and a butter burger for lunch. But like my friend Terry McKay growing up in Green Bay, we go to Kroll's, he'd get extra butter on his Kroll's hamburger. So you have to limit your saturated fat. Now, the healthiest food of all, as far as fats go, are monounsaturated fats, or in general, the omega-3 fats are healthy fats. And they're present in the plant kingdom. And the animal kingdom is all saturated fats. Butter comes from an animal. So if you really want to be healthy, you want to try to get all your fats from the plant kingdom. And one of the best fats is olive oil. And you can even go to the olive cellar on Northland, and you can buy olive oil that now tastes like butter. Or they have one flavored with sesame. I mean, it's to the point now where if you really want to be healthy, you could do like the Italians do, or those in the Mediterranean. They put olive oil on everything. I mean, if you've ever been to France or that part of Italy, when they have bread, they never put butter on it. They dip it in the olive oil. So that's the healthiest answer to the question, as far as we know at this point in time. As much as you can, use plant-based products for your fat. Saturated fat in limitation is okay, and avoid trans fats.
So in baking, you recommend butter?
Yep.
So,
So what is like shed spread, where it says it doesn't have trans fat, but it's not butter and it's not margarine? What is that?
What's it called?
Shed spread? Or like Blue Bonnet?
Blue Bonnet?
They both say that they don't have trans fat, but I don't think it's butter either.
There is an oil called plant stanols, and some of these synthetic spreads are made out of plant stanols, which is a healthy fat. I don't know if that particular one, but if you look under the agreement, the ingredients, if it says plant stanols, sterols or stanols, that would be a healthy spread to use.
Okay.
But I'm not familiar with that particular one. Oh, by the way, questions are fine. So, so if you want to prevent a heart attack, the first thing you need to do is determine your risk of a heart attack. And then you got to treat your risk. And this is kind of what it's all about in 2018. There's no such thing anymore as a normal cholesterol. There's a normal blood sugar. There's a normal red blood cell count to see if you're anemic or not. There's a normal platelet count. There's a normal blood sodium. There's a normal liver panel. But of all the blood work we do, we no longer call cholesterol as normal or abnormal. It depends on your risk. Now I have to ask a question. How many in here have had a heart attack? A handful. Or it also counts, how many have had an artery fixed with a stent or bypass surgery? Okay, that kind of counts like a heart attack. So you are in the highest risk group of having another heart attack. But guess what? We're really, really good at preventing a second heart attack or another bypass or another stent. We're very good at it. And what we're going to talk about today works. So you're in the highest risk category if you've had a heart attack, if you've had bypass surgery, or if you've had a stent. That's as high as a risk as it comes. So you have to do everything we're going to talk about so it doesn't happen again.
What risk are you at if they can't put a stent in? There's too much blockage.
Too much blockage? Then they
Medicine.
bypass around.
And medicine. No, they
And-
can't do that either.
Can't do that in. Then you need to treat all of your risk factors aggressively as you can. And if it's an important artery that you have to, the arterial tree is, some arteries are more important than the others. And if it's really
It's the
important,
whole right side.
yeah, the right side is the least important, actually. sorry, but the right coronary artery, rarely, heart attacks in the distribution of the right coronary artery rarely kill people.
That's what they said, if you have trouble on the left side, you better get hiking.
Yep, we call that spot the widowmaker, right? Probably all, the left way high up is trouble. The right side, people tend, even if they have, they tend to survive those heart attacks. It's just, I don't want to say it's not important, but it's the least important. Now, if you've had a heart attack, or a bypass or a stent, you gotta do everything right. And, you know, if you see your cardiologist, they're gonna tell you to get your LDL cholesterol down to 70.
Get what?
They're gonna tell you to get your LDL cholesterol, your bad cholesterol down to 70. If you are at low risk of a heart attack, and what's that? Well, it's a calcium score of 0. We'll talk about calcium scores. That's the best way to determine your risk of a heart attack. If you've never had a heart attack and your calcium score is 0, your LDL cholesterol can be 190. Go figure. Your total cholesterol can be 260. So what? You're not at risk. So it all depends on your level of risk, is where your LDL cholesterol, where your cholesterol should be. So there's no such thing as a normal cholesterol. You got to figure out your risk. And once you know your risk, now you know what your cholesterol should be. You know, the average American has a total cholesterol of 220, a bad cholesterol of 140, a good cholesterol of 40, and a triglyceride level of 150. So if the average American has a bad cholesterol of 140, you know, all the early trials, everything, we used to shoot for 130. We figured, oh, it's a little better than 140. So if your bad cholesterol, your LDL cholesterol was 130, we used to call that normal. Under 130 was abnormal, was good, and over 130 was abnormal. The problem with that is, you know, what's the #1 killer in the country? Heart attack. You can add up, you know, all the cancer, all the kidney failure, all the diabetes, it still doesn't equal heart attack. So average just isn't good anymore. So let's talk about the high-risk people. So if you've already had a heart attack, or if your calcium score is over 300, or if your calcium score is in the top 25th percentile for your age and your gender, you're at the high risk. Now, what I'm asking here is not easy. I said we were good at preventing a heart attack, and we are. We're still here, right? I mean, that's why we see people. That's why cardiology is so much fun, because we can help people. The majority of people in this country who die of a heart attack, they drop dead, it's their first symptom. They had no clue they were at risk. I gave a talk at the Rotary Club last Friday, and they started their ceremony with a prayer for, I believe it was Smith Realty, the owner of Smith Realty, you know, dropped dead of a heart attack. It just, you know, it just shouldn't be. So here's what we ask you to do. Okay, you want to get your LDL cholesterol below 70. Now that's low, right? That's really low. And a lot of people have trouble getting their LDL cholesterol down that low. The easiest way to do it is with a statin, a high intensity or potent statin. If you don't get muscle aches on statins, you got it made, because they will cut your cholesterol in half. If you get muscle aches on statins, now we're talking, you know, we got work to do. But you want to get your bad cholesterol down below 70. You need to exercise for 30 minutes a day, 5 days a week. And I mean exercise. It doesn't count that you've got a job where you're active and on your feet all day, 5 days a week, and you're tired when you get home. Or you get a job where you do shift work, so you're up all night, and again, you know, maybe physical activity. That's just not the same as, you know, walking, biking, doing something where you move and you get your heart rate up for at least 30 minutes. And you gotta do it 5 days a week. Not many people do that. There's, I'm in a group of 5 guys who play a lot of golf together, and 2 of the guys, even though they would golf a few days a week, they never exercised. They both had heart attacks, one 2 years ago, one 3 years ago. What did they do after they had their heart attack? They both bought a treadmill. Now they both get up in the morning and they exercise for 30 minutes, 5 days a week. It's just, why didn't they do it before that? You know, didn't think they needed it, didn't want to. Exercise is really important to prevent heart disease. And it's gotta be a lot of exercise. This is asking a lot, 30 minutes, 5 days a week. So I didn't tell you it was gonna be easy. But it works. Blood pressure needs to be below 130/80. You need to lower your glucose.
How do you do that?
How do you lower your glucose? You could take a whole bunch of pills. Yeah. Most patients have high glucose or diabetes because they're insulin resistant, meaning their body is actually making more insulin than they need. It's just that your tissues aren't responding to it like they're supposed to. And the problem that even the American Heart Association has is that most of the medicines used to treat diabetes, guess what they do? They stimulate more insulin production. Well, didn't I just tell you the problem with diabetes was your body's making too much insulin already? Mm-hmm. So you're going to take medicine that increases insulin in your body? That will bring your blood sugar down a little bit, but it slows your metabolism, you gain weight, your triglycerides go up, and your risk of heart disease increases. The one medicine that does lower blood sugar without increasing insulin in your body is called metformin. So that's typically the first medicine we recommend for diabetes. The newer medicines just coming out now for diabetes over the last few years, Trulicity, Byetta, Victoza, are also very effective in lowering your blood sugar by reducing your body's insulin production, but a lot of them are really expensive.
Is there a way to do that without pills?
There is.
How do you do that?
Fasting. I'm not kidding. In fact, any of you know Dr. Ackel? Peter Ackel, great cardiologist. Yeah, one of my partners. He recommends this to his patients. It's a diet of intermittent fasting. It is kind of the latest diet that's been in vogue. If you watch, TV, you'll see talk about it. There's some new books read about it. Sometimes you got to be a little careful. Not everybody can to go through with it, but it's worked for Dr. Ackel and it works for a lot of people. It does make sense in a way that by fasting for 24 hours, 1 day a week, in that 24 hours, your body will become more sensitive to the insulin that you make, and your insulin level will actually start to drop. In fact, they now know that the way surgery for obesity works is your body stops making insulin for a while after the operation. That's how a lot of people lose weight. Yeah.
What's a good glucose number?
A good glucose number is a fasting glucose under 100.
Thank you.
Yes?
What actually would be fasting? No food, just water for 24 hours?
For the blood test, I think they 8-10 hours, something like that. For a fasting blood sugar, you should have, just water for 8 or 10 hours before the blood test.
But this intermittent fast,
The intermittent fasting is at 24 hours.
24 hours, no food,
No food.
water.
Water, salty broths, and in the diets where they promote intermittent fasting, if such and such a day is going to be your day for fasting and you don't feel like it that day, that's fine. You just pick another. It's not like fanatic where you have to torture yourself. Because eating it's a behavioral thing, and there's a lot. You can just Google the Idiot's Guide to Fasting, the Complete Book of Fasting. There's a number of books out there, that can help to get you, to get you started on an intermittent fasting diet. But that is one way to lower your blood sugar without medication. Yeah.
How low can you get your glucose number?
How low? Just so you don't get lightheaded or dizzy. How's that? No, it's very rare that you would have a medical condition where your blood glucose could go too low to cause you trouble. On this fasting diet, you need to be careful if you have diabetes and you're on medication for diabetes. That's a common scenario where the blood sugar can get too low, and it can be risky to go on that kind of diet. Because again, most of the medicines that we use to treat diabetes work by stimulating your body's production of insulin. If your body makes too much insulin, it's going to drop the blood sugar too low, and that's serious. In fact, in a lot of we used to think that every patient with diabetes, any here with diabetes? Okay, there's a number called the hemoglobin A1C, which gives us an average of what your blood sugar has been for 6 weeks, before the test. And we know that if you get your hemoglobin A1C below 6.5%, you're very less likely to have blindness or kidney disease from diabetes. It's very effective in preventing those two complications, blindness and kidney disease. However, in order to get the blood sugar that low using medical therapy like insulin and glyburide and all the others, a number of people were dying because their blood sugar was too low. And a lot of the medicines we use to get the blood sugar that low, like I mentioned earlier, slow your metabolism, you gain weight, your triglycerides go up, your cholesterol goes up, and you're having more heart disease. So the American Heart Association now recommends that hemoglobin A1C at 7.5% is good, because they don't want heart patients going on all these pills for diabetes that result in weight gain.
-6.3.
Pretty much all the common medicines used to prevent or used to treat diabetes slow your metabolism to the point where you're going to gain about a pound a month. So if I see a patient who comes in and their internist put them on insulin in the interim, I tell them, okay, you have to, a pound is about 3,500 calories. So that's roughly 100 calories a day. I tell the patient, so, okay, you go on insulin, now you have to change your metabolism in another way by 100 calories a day so you don't lose weight going on the insulin. And 100 calories, you can either walk a mile or eat one less cookie. They're both about 100 calories. I'd rather have a cookie. Yeah. So that's lower your glucose. Absolutely no smoking and take an aspirin.
What about the recent study on aspirin?
So the question, what about the recent study on aspirin? The recent study on aspirin was, so this, by the way, is hot off the press. 2019 guidelines on the prevention of heart disease. In fact, it's online before print. It's not even print yet, except for this little handout here, which is acc.org/GMS prevention, if you want to download it from the internet. And I just stole this picture here. So this is the brand new guidelines just out. Low dose aspirin for primary prevention now reserved for select high-risk patients. Right what you said. The study came out last November, and what they did, they took 70-year-old Americans and Australians, it was done in 2 countries, 70-year-olds with no previous heart disease, and they were at very low risk for heart disease. So as far as we know, they never had a heart attack, they never had a stroke, they never had a bypass, no diabetics in this study, healthy 70-year-olds. And they studied them for 5 years, half got aspirin, half didn't. More people had bleeding problems, gastrointestinal problems on the aspirin than heart attack or stroke prevention. Therefore, what came out last November was, if you've never had a heart attack or a stroke, you don't need to take aspirin. The bottom line is, so that's true. Now, if you've had a calcium score, there's again, that's a better test to predict your risk. If your calcium score is over 100, you should take aspirin. If your calcium score is under 100, don't. But it's true, a lot of patients, a lot of people, they don't want to take Lipitor, but they'll take an aspirin. And they're probably doing more harm by taking the aspirin. So if you're at low risk, remember the very first slide, determine your risk. You need to know your risk. And if you're at low risk, you don't need an aspirin. You're more likely to bleed.
So in other words, you're telling them to get a calcium test.
What's your calcium score?
Yeah, the calcium score is really the best. You can you go to your doctor and sit down and give the complete family history of heart disease in your family, and you can do a physical exam. Listen to your heart, take your blood pressure, check your pulses, do some blood tests, get your good cholesterol, your bad cholesterol. And you can tell you with 55% accuracy whether or not you were going to have a heart attack. Or you could save all that money and flip a coin. The point is, 55, we just weren't very good at predicting heart attacks based on the history, the physical exam, and the blood tests. And the calcium score, it's not perfect, but it's about 85% accurate.
The calcium score, when we were here last week, the doctor said that if you're already at risk, then you don't need to have you have to do what, calcium score isn't gonna help you now. I mean,
Amen.
you can have, he said,
Yeah.
don't have the test done, you're already at risk, you had a heart attack, you have heart issues. And the calcium score is not gonna be what you need to have now.
That's an important point that I agree with 100%. If, and that's, hopefully I made, when we started up the talk, if you've already had a heart attack, you're in the highest risk category already, you don't need a calcium score.
But if you never had a heart attack and everything else, you don't know if the calcium score will tell you a lot.
Correct. That's
So
correct.
it's not like you
Yeah.
should have it done, but if you're not sure, once you have it done, you know where you're at.
And it goes both ways. I mean, we see people, like my stinking neighbor, who has, his calcium score is 0. This guy never exercises, he's a smoker. He's like 52 years old, he just, but you know, whatever, it's zero. So he's at low risk, you know? And then we see people, geez, all the time, who are just like, you know, the specimen of fitness, and their calcium score is 600. How could that be? And that's why we just don't know. You know, we just can't predict. You know, the other thing is, if you're going to do all these things, then you don't need a calcium score. If you're going to exercise, if you're going to exercise 150 minutes a week, physical activity, well, it is helpful whether or not you need an aspirin. We talked about blood sugar and diet and metformin, and these are the other new medicines, the Trulicity and the Byetta or Victoza that are really good for diabetes because you won't gain weight and all the other stuff. These two are real expensive. So diet, man, I'll bet. The other thing is, you know, these two golfing friends of mine, geez, you know, I'm sure they tell their one of Dr. Gatornson's one of the guys who's Dr. Gatornson, the other one goes to St. E's, Dr. Lee. I bet they tell them they eat healthy, but I see them at the golf course. You know? One thing I do like, and there's a little more in this handout, for the first time, you know, you saw the American Heart Association was telling us what you shouldn't eat. You know, don't eat meat. Now they're kind of telling us what we should eat. I like that. And, you know, when I see patients, you know, often what I'll say is, you know, eat real food. If God made it, eat it. If man made it, turn away. Anybody here have an interest in Culver's or Galloway Dairy? I was asked to give a talk out at Galloway once. Yeah, because they would get a big cut on their insurance if they could get all their employees' cholesterol levels down by like 5 points. So I was out there to give a talk, and before I went out there, they wanted me to see the company, which I thought was really cool. It's family run, but I mean, the sugar comes in a gondola, and the butter comes in these huge blocks that they have a special machine to move, and maybe it's even margarine, I don't know, but and you know they sell to Culver's because their butter fat is 14%, and most in the dairy industry they can only get the butter fat up to 12%. And that's why everything tastes better at Culver's.
What about eating Wheaties in the morning? I've eaten them, I'm gonna be 90 years old in about 5 months, and I've been eating them since I was about 8 years old. When I also exercised, I worked as a plasterer until I was 82 years old, and I plastered churches and schools that were 30 feet up in the air, and that's what made me in what good shape I am working.
Yeah.
And physical.
Yeah.
And I didn't need to exercise, you know, other than that.
Yeah.
But I worked for 60 years at the same trade.
Hard to argue with that.
And my father was a plasterer,
Yeah.
and he quit when he was 65, and he lived to be 94.
So you got some good genes too.
Yeah, that helps.
You know, for a while, Wheaties were made with trans fats. That's when they were bigger and flakier, and you know, their texture has changed over time because the trans fats are now gone. My only comment with that is you need to be somewhat careful with wheat for breakfast, lunch, dinner, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. The book was called Wheat Belly, It's been around quite a while now. But, you know, wheat, Americans love wheat. And in America, the wheat industry, the grain industry is not regulated by the FDA. And through genetic engineering, you know, they changed the wheat plant. You know, it used to be amber waves of grain. It's now a stalk about 18 inches high. The wheat used to have 12 chromosomes in it, now it's 46. It's more malleable, it's resistant to, you know, bugs and things. It's much better for industry, but the human hasn't figured out how to metabolize it yet. And there's good evidence that wheat, you know, every meal, every snack, every day of the week is a problem. Now, certainly wheat is for breakfast, you know, I mean, but you need to be, you know, they say in the grocery store now, the only aisle that doesn't have wheat is the detergent aisle. So try to vary your grains. You know.
Yeah, I did 12 years ago. It was just a little one though.
Dr. Wilson kept them going, right?
Yep.
Yes?
And since then, I've had a total not a total, but 85% blockage in this thing, and I went blind. That's how I knew something was wrong. And my doctor at the VA said, "You're going right to the surgery today." He said, "I'm not fooling with you," and he sent me over to the hospital, and I got a real good doctor. He fixed that all up, and I've been real good.
There you go.
I've been cutting wood for 3 years. Not cutting so much, but hauling a lot of it. And boy, does that ever help you. I brought some last year. I brought 2 truckloads of wood to 2 different doctors. And one of the doctors,
They watched you fire.
and one of the doctors was 47. He said, "My God, you're in better shape than I
The other thing that's important on here is, you know, it's gonna tell you what to eat, vegetables, 3 cups a day. You know, not many people, you know, I mean, it makes a difference. 3 cups a day of vegetables. Fresh fruits, 3 fruits a day. The sugar in a fruit will never raise your blood sugar. It's in fresh fruit, it's with the fiber in the fruit, a lot of it's metabolized in your gut. I mean, you'll get diarrhea from eating too much fruit before the sugar in the fruit is gonna raise your blood sugar. Nuts, you know, tree nuts, almonds. It's a healthier snack than Cheetos. Legumes, or, you know, beans, fish, especially the oily fish. The more color in a fish, the higher it is in omega-3 fatty acids. So the fish that's really good for you is salmon, swordfish, mackerel, sardines, anchovies, the colored oily kind of fish. You know, the Friday night fish fry, not so good. You know, that's sort of another one of the issues is no study has ever shown that fish oil tablets make a hill of beans a difference. Ever. There have been some good studies that show that eating oily fish makes a difference. One study was done in Alaska where they compared Eskimos to you know, Anglo-Saxon people who lived in Alaska. And the other study was done in the Mediterranean area where they eat a lot of fish. And there's something about eating oily fish at least twice a week can help prevent heart disease. And that's what the American Heart Association has always said. That you should have 2 meals a week of oily fish. Now, not a lot of people like oily fish, so they figure, well, I'll just take a fish oil tablet, but it's never been shown to make a difference. So if you're on fish oil because you think it's gonna help your heart, that's one less pill you can take. Yes?
Does the Institute have a dietitian that we could talk with?
No, we should get one.
No.
Yeah.
Are you still affiliated with with AMC, because they do,
They do, and they have good dietitians. Yeah, we're still all on medical staff.
so she could be referred
Yes,
to.
it could be referred. Yeah, they kicked us out.
Well, they're having their problems.
You know, and I got along with the dietitians really well, and I love the dietitians. But, you know, one thing they're gonna tell you though is, you know, they heard me talking about a fasting diet. They heard me talking about, the wheat thing. They're always gonna go back to calorie restriction and exercise, energy balance. You know, your serving of food should be the size of your palm, you should cut down calories and exercise more. And that's always good advice. It just, sometimes it's hard because, you know, the food you're on, you already feel like you're eating less than everyone you know, and it's hard to lose weight. And some of that's, you know, it is a metabolism thing, it really is. And sometimes it's related to the medicine. But dietitians are always good to see. And of course, you know, tobacco, boy, we're gonna go with that. I bet nobody here smokes, maybe I'm wrong, but. So if you haven't had a heart attack and you want to, you know, you need to know your risk of a heart attack if you've never had a heart attack. And again, what the American Heart Association says is the first thing you should do is go see your doctor and get your risk estimated. That's what I was recommending earlier. Well, here's you could just Google ASCVD risk estimator plus. But this is the one where one of the main things that comes into this is the HDL cholesterol, or the good cholesterol. You know, before we had calcium scoring, the one single blood test that would help the most was the good cholesterol. If you had a high HDL cholesterol, that's the good cholesterol, you were less likely to have a heart attack. And if you had a low HDL cholesterol, you were more likely to have a heart attack. And that still hasn't changed. However, what's much more accurate is the calcium score. And here's a picture of a calcium score done here. I mean, it's really a simple test. It takes a couple minutes. You lie on your back, and you go through a CAT scanner, and when you lie on your back, you know, here's your vertebrae. This is a bone. Bone has calcium in it, so it's white. Here's your sternum, so that's white, and then here's the ribs. But we shouldn't see any white in the middle area. And here you see, this is the left anterior descending artery, all the white calcium on there. The only thing that results in this is plaque, that gooey plaque in the artery. Once it's been there 4 or 5 years, your body heals it with calcium. Essentially, it turns it into bone. And here again, all this calcium. Now, actually, once it's healed, once it's calcified, you're okay. You leave this stuff alone. This is never going to hurt you. Your body has healed that. It's turned this cholesterol plaque in the wall of the artery essentially into bone. And there's never going to be a problem. The problem is going to be, you know, upstream or downstream, well, we know there has to be plaque there, because there's plaque right there. That's the gooey stuff that can, break off or plug up the artery and cause a heart attack. When people come into the hospital with heart attacks, you go right to the cath lab and they take care of things. Where's the trouble? It's always upstream or downstream of the calcium. It's almost never right at the calcium. This is just a way that we can see your arteries and determine how much plaque is there. And the calcium score is nothing more than every pixel on the screen that's white gets a point, and you add them all up. On a scan like this of the heart, this is 500 pixels by 500 pixels, and every pixel that's bright white gets a point. You add them up, that's your calcium score. So if your calcium score is 0, you are very low risk. You don't need no stinking statin. Whatever you're doing is working. Keep it up, you're done. And that's the nice thing about it. If your score is 1 to 99, you're at a mildly increased risk. You don't have to, you can go to Culver's a couple times a week. You don't have to exercise every day of the week. You can get by with an LDL cholesterol of 100, 130, something like that. If you're getting it down with lifestyle and diet, you don't need to go on medication. You have low risk. And the other two groups are where we recommend more aggressive therapy. Now it's somewhat age dependent. Here you can see in women, the bright green is 0. So basically, not too many women, we usually recommend starting looking in women at age 40. Because it's pretty rare to find calcium in the heart arteries below age 40. And as you age, your calcium score increases. But even a number of women, 25% have a calcium score of 0 at that age. Men tend to have more plaque in their artery. It's like the whole thing gets shifted 10 years to the left. We think it's related to menopause and hormones, though it hasn't been entirely figured out yet why the difference. So, if you get the bad news that your score is over 300, now we're going to treat you just like someone who's had a heart attack. But the reason we're giving this talk in the first place is it's not all doom and gloom. Again, most people when they have their first heart attack, or most people's first event, there's 800,000 people in America who die every year of a heart attack. 800,000. And over half of those, their first sign or symptom is they drop. They has no idea.
What?
Over half of those, their first sign or symptom of heart disease is death. Sudden death. And of the other 400,000, the majority of those are over age 80.
Age what?
80. And there's some truth to this, but when you're in the hospital and when you're, for whatever, if somebody ever dies, even if they're 95 years old, when you sign a death certificate, as a doctor, you have to put down the cause of death. If you put old age, they'll bring it back to you and say, that's not a cause of death. So you put heart attack down, because then nobody bothers you. You figure, so I think the data is really skewed. I'm not the only one who does that. I think.
Glenn, Have you had any experience with young type 1 diabetics? And because we had a counselor that worked for me, and she was a type 1 diabetic. And she had what I call galloping atherosclerosis, bypass, even a heart transplant, and still died from plugged arteries. Yeah. And I just, have you had any experience with calcium scoring in that group?
Question is, what about type 1 diabetics? Another term for that is juvenile diabetes. These are patients who get diabetes typically, well before age 20. In that type of diabetes, it's an autoimmune disease. For some reason, their body's own immune system is destroying their pancreas, so their insulin levels are 0. They cannot make insulin. And this group of patients, they do have rip-roaring, what we call atherosclerosis, that even aggressive medical therapy often it's a real challenge to prevent complications in that subgroup. You're right. And they do, for some reason, they tend to calcify their arteries head to toe. That's a group of patients who, with diabetes, often, has amputation and other problems as well. Type 1 diabetes it's a tough disease. So kind of back to so if your calcium score is, in the middle area, 100 to 299, now you're sort of at average risk. Again, what we're going to recommend is be a little more aggressive with your treatment. And just because you're at average risk, treat your risk more aggressively so you don't have a heart attack. Again, we're going to ask you to do a lot of the things that the high-risk people are asked to do. Exercise, eat healthy, control your blood pressure, get your blood glucose down. Those things really do make a difference. And again, especially with the new information on aspirin, the score of 100 is a threshold for whether or not you should take aspirin. So the nice thing, if you're under 100, you don't need aspirin therapy. You're only at a mildly increased risk of a heart attack. And in this group, we usually have a discussion with the patient of, whether or not you want to go on statin therapy. And often a patient chooses not to go on statin therapy. And that's reasonable if you're at low risk.
What are the disadvantages of statin?
Muscle aches. The disadvantages of statins are muscle problems, muscle ache, muscle pain, muscle stiffness, muscle weakness. It's a real problem. About 1 in 10 people can't take a statin because of that. Controversial about what statins, diabetes and brain. There's something about the high intensity statins, that would be high doses of Lipitor or Crestor, that do seem to raise your blood sugar a little bit. We don't know if this is just an association on trial data. Some people say, well, if I'm on Lipitor, I can eat more sugary things, and so the blood sugar goes up a little bit. Or maybe there is a real link there. That's kind of a current area of interest. And as far as the brain goes, for every study that's out there that shows taking a statin causes dementia, you find a study that shows taking a statin prevents dementia. So we're not sure. What I should say is, as far as the liver, there's a lot of concern about statins in the liver. And actually, hepatologists, liver specialists are now using statins to treat liver disease. It's like, go figure. You know? I remember when, I mean, I was in practice in 1986 when the first statin came up, Mevacor, or lovastatin. The animal model for human atherosclerosis is the bunny rabbit. And if you give a bunny rabbit a statin, their liver turns to mush. So we thought, when statins first, remember Dr. Redmond, when statins first came out, man, you had to have a complete liver workup to make sure you didn't have any liver problems. And you had to check the liver enzymes every 6 weeks. For 6 months, and then because we thought for sure we were going to trash the liver on statins. Well, as it turns out, our livers are not like the bunny rabbit's liver, fortunately. And again, statins are now they're not FDA approved for liver disease, but there are a lot of cases where statins seem to help the liver. So you shouldn't be concerned about your liver on statin. The muscle is the real deal. A lot of people just can't take statins because of muscle. Well, all right, I mean, that's kind of what I had to say. There were some great questions.
Price of the calcium score?
Pardon?
Calcium score price for people who are not doing.
$25.
Oh,
Just
$25
skip it, right?
for a calcium.
$25 and then $25 for an overread.
Could you explain the overread again?
Can I explain the overread? We're not qualified to look at the lung for little nodules that could be precancerous. So we offer for another $25 to send the CAT scan to a radiologist to look for nodules for lung cancer.
That's important.
In my humble opinion, it's a waste of money.
Oh dear.
Unless, you paid for it?
I said, oh dear.
Yes.
I
Unless,
have one today.
pardon?
I have one today.
Calcium score?
Yeah,
and
this morning, right over there.
But he has lung cancer.
Okay, I was just gonna
Well,
say,
but his dad did.
if you got a family history of lung cancer or you're a smoker, then it's worth it. Otherwise, it's so likely to find these teeny little nodules in the lung, and then the radiologist is gonna say, you need another scan in 6 months to make sure it doesn't change. And then in 6 months, then doesn't change, but then they see another little one. And they say, well, you need another CAT scan in another 6 months. And in fact, we started doing calcium scoring in 2006 because of the data that was prevalent back then on this being the best test to predict your risk of heart disease. But it wasn't until last November when the American Heart Association finally recommended calcium scoring. So we now have a recommendation from the American Heart Association. And their two main complaints against calcium scoring was the cost of the test and unnecessary testing done as a result of the calcium score. And this is what unnecessary testing is about. You have the scan done to look at your heart arteries, and a little 3-millimeter nodule is found, and that leads to more and more and more testing. And most places Larry Sobel, give the guy credit. He's the one who brought calcium scoring here in 2006 and prices at $50. We used to have people come up from Chicago, Milwaukee, because down there it was 2,000, 1,500. So the cost at this cost, it's really.
It's the least expensive across the country, at $25, on the best machine in the state.
Yeah. Yeah, we just spent $2 million on a state-of-the-art machine so the radiation dose is so low, there's no cancer risk. Unless you get a calcium score every month. You only need one. Is that a question?
I got one question. I noticed, I drink a lot of milk, and I noticed nobody hardly drinks milk anymore. And I just read where 87% of the milk that we get in Wisconsin is made into cheese. So that tells me that, and I've always drank a lot of milk, and I wonder why, and if that's good for you, or what do you think of it?
Well, I drink a lot of milk, but it's skim milk.
Well, I don't drink the skim, I drink the 1%.
The 1%, yeah. Again, you could, the American Heart Association no longer says, no saturated fat.
That's
Yeah, isn't that amazing? There's nothing in here on, this is your American, you pay tax dollars for this stuff, Your government is telling you there's nothing in here about no saturated fat. But if you go to a dietitian at Daycare Regional Medical Center, they're gonna hone in on your saturated fat. So I don't want you to leave here thinking it's okay to eat it, but you need to limit it. And if you choose milk as your source of saturated fat, or you choose butter as your source of, that's absolutely fine.
As long as you don't have too much of it.
Correct. You need to limit your.
What about all these people that drink a lot of coffee?
Yeah, well, a lot of, is that coffee?
Yes, no, it's water.
Coffee is in again.
Yes.
Up to 6 cups is okay. These are 6 ounce when they, so that's, yeah, so you need to do 6 ounce, 636, but coffee, a reasonable amount of coffee is okay, but it's supposed to be not decaffeinated unless it's a special kind in a drip. There was probably something of, remember the old percolators where the coffee would boil over and over again? That did something, because a long time ago, the studies on coffee were not good for heart disease. But yeah, coffee is
I don't drink much coffee.
but again, just not the Starbucks, the latte. I never had sugar in my life. It's getting to, yes.
If you see an elevated calcium score, even if you're following a good diet, even if you're exercising, do you still see the calcium scores typically increase over time? Are you kind of doomed, like once it started, it's just going to continue?
Yeah, well, once you have a high calcium score, you're doomed for the calcium for the calcium score test, because
I don't mean for the test.
Yeah.
I just mean like, let's say I have a calcium score of 20. I don't know.
yeah.
Now, is it just going to progress over time regardless?
And yes, is the answer.
But
Now,
little.
if you have a really low calcium, like 20 is a pretty low calcium score, and you choose not to go on a statin, you have muscle aches, and you choose not to exercise 150 minutes a week because you're a mom and a wife and you're busy, and you choose, not to have 3 cups of vegetables a day, you may want to get another calcium score test down the future. But if you're doing everything we're telling you to do, you probably don't need one again, because people who aggressively treat their risk factors, their calcium score increases compared to those who don't. And the reason is, see if I can explain this. It kind of goes like this. When you have your first calcium score, we know that about 10% of your arteries have calcified plaque and 90% have uncalcified plaque. It's like a ratio of 1 to 10. That's just the way it is when you first have it. Now, if you aggressively treat your disease, so say you had 10 units, we think over 10 years, you may get 50% more plaque in your arteries. So it's going to go from a total of 10 to 15. However, it's probably mostly going to calcify because you're doing healthy things. Remember, calcified plaque is good. So your calcium score is going to go from 9 to, in this case, 14. Whereas if you don't do anything, you may quadruple your plaque. You may go from 10 to 40. But your ratio is still going to be 1 to 10. So your calcium score is going to be 4. So instead of 14, you say, why did I go on all that treatment? Well, you're sitting on 4 times as much plaque because you didn't do anything to change it. I don't know if that made sense or not, but the bottom line is, going on treatment, your plaque growth is gonna taper off, but you're gonna calcify what you have, again, which is okay. And if you don't go on treatment, you're gonna double, quadruple your plaque in that period of time.
I do have one more question. So we see this change a lot. It's hard to keep up with it. What do they do in other countries, like Europe, for instance? Do they have I think they're heart healthier than we are, and it's because of their foods.
I think so.
I mean,
Yeah.
can you bring that in as a study, and can we follow some of what they do? I mean,
The European guidelines?
yeah, I mean, it would help maybe for everybody here.
Yeah.
I mean, I think our foods that we eat are part of our problem.
Yeah, well, you're right, there are separate guidelines for Europe that are in some ways similar to ours, some ways different from ours, but diet is vastly different in Europe compared to ours. In general, they recommend the Mediterranean diet, and they've been pretty constant with that. And the nice thing about the Mediterranean diet is, you can have meat. 10, 20 years ago, the recommendations here were no meat. You have to eliminate red meat. Another thing I think that makes a difference, we talked a lot about eating real food. If you've ever been to Europe, they don't have a Costco or Pick and Save. Every day people go to the market and they buy fresh food. In fact, a lot of homes in Europe, they don't even have refrigerators. Every day they're buying fresh food. And they prepare their food. And they do the dishes when they're done. It's so different from, I see so many patients where they, we get talk about diet a little bit and oh yeah, I have a healthy diet, and we come back around, their healthy diet is frozen pizza. Come on, it's not McDonald's. It's, the cover of the New England Journal not too long ago, they had, for this, it was a talk on heart disease, and they showed the unhealthy guy was having a frozen pizza. The other thing in Europe, again, they have the wheat they have is not genetically modified, and they have, they eat a lot of couscous and barley and all of these other grains that are different than America. Their dairy, their meat, it's they don't have all the pesticides and the chemicals. Yeah, so the diet is certainly, in fact, for a while, there was this French paradox. Why don't people in France have the same heart disease that we have? They thought it was the red wine, and they found this chemical in the red wine that was an antioxidant called resveratrol. So they started selling resveratrol pills. They didn't do anything.
Thank you, Doctor.
Well, you're welcome. Thanks for coming, everybody. Good crowd. Yes, sir. You're welcome.